Welcome to Holy Health, the podcast where cutting-edge health insights meet timeless biblical wisdom. Join us as we explore the latest in wellness, fitness, and mental health, all while grounding our journey in the spiritual truths and guidance found in the Torah. Whether you're looking to nourish your body, mind, or soul, we'll help you live a life of balance, vitality, and faith. Tune in to discover how to achieve holistic health through the perfect blend of modern science and ancient wisdom. Let's dive into the fullness of life, body, and spirit together. Hey guys, I am so excited to be back this week, though it's been about, I believe, a month, maybe 3 weeks to a month since we last put out an episode. I have recorded several very interesting things, and I don't know, we might have to start releasing things more than twice a week. It would help if some of you would volunteer to come on and help me with these Torah extros, because finding fascinating and interesting people is easy. It's not always easy finding people who want to come on and help me out with the Torah parts. And we need both. That's part of what makes Holy Health so special. So if any of you feel like you would be a good fit, please let me know. And we will continue to bring you these really interesting episodes. So this week's episode is something that I recorded, I don't know, maybe a few months ago already with Dr. Aaron Hartman. And we were kind of trying to discuss, I like to be very topic specific. So when I asked him if there was a topic that he had in mind, one of the things he offered me was medical gaslighting. And I felt like that was such an important topic to cover, because I know that here and there I've had patients with some different types of symptoms, or people will dismiss them. I have one person in particular I can think where this person is definitely being dismissed because they are very, very overweight. And whenever, nobody likes to feel like they don't know what they're talking about. So I think this can be true even in terms of doctors. So people will often try to blame you or put it off on something psychological. And when it comes to pain that I can't figure out, and I might feel like maybe it is coming from a psychological place with people, I've often kind of said either it's coming from a psychological place or there's something bigger at play than what we can understand. And I think that is really where this gaslighting comes from. When something is, you look at all the test results and everything looks great, but yet this person is still suffering. What are they being told? It's in their head, or if you would only lose weight, or a variety of other things. So Dr. Hartman did such a great job. I want to tell you a little bit about who he is. It would help if I had it open and ready, but you guys know I like to read it straight off the bio. And I'm sure there's a way I could read it off my computer, but here we are. Dr. Aaron Hartman, MD, is a board-certified physician in functional medicine, integrative and holistic medicine, family medicine, and anti-aging and regenerative medicine. He is the founder of Richmond Integrative and Functional Medicine and serves as an assistant clinical professor of family medicine at VCU. Dr. Hartman is also a key opinion leader for Novo Nordisk in diabetes research, known for his root cause, systems-based approach. He specializes in helping patients with complex and chronic conditions by addressing the underlying drivers of disease through personalized, science-based care that integrates lifestyle, nutrition, and advanced medical insights. So I know you guys are going to get a lot out of this episode. I know you're going to enjoy it, and please give me feedback. I always love to hear your thoughts. So my brother, Rabbi Shlomo Ben Zeev, is somebody who is always willing to help me out when I have a topic that maybe other people don't want to cover, or when all of a sudden it's the week before I'm putting out an episode and I'm like, wait, I didn't do an extra. My brother is always helping save the day. And that is true of this week as well. So Rabbi Shlomo Ben Zeev is not just a rabbi. He's a deep thinker, an engaging teacher, and a lifelong seeker of truth. For over 25 years, he has dedicated himself to uncovering and explaining life's biggest questions with clarity, logic, and just the right amount of humor. With a Bachelor of Education, an MA in Hebrew, jurisprudence, and rabbinical certification from the chief rabbinate of Israel, Rabbi Ben Zeev brings both scholarly depth and real-world relatability to his writing, teaching, and lectures. He is also a scribe, a sofer stam, and a mohel, ensuring his connection to tradition runs as deep as his curiosity. He is also the innovator of drsteigen.com. Well, not really. Actor Dr. Steigen, a stender that is actually a stander that you guys have heard me talk about because this is physical therapist approved. This is a stander that, or stender if you would like to call it, that you can actually raise and lower and tilt at such an angle that you are able to keep your head and neck in alignment, which is what I'm always teaching my patients about. So there will be a link in this episode to that as well. So as always, I love to hear what you guys think about this week's episode, and Shabbat Shalom. Hey everyone, welcome back to Holy Health. I am excited to be here today with Dr. Aaron Hartman and to discuss a topic that we don't hear enough about, like in any way, shape, or form. We're here today to discuss medical gaslighting. And Dr. Hartman, I'm so excited to have you here, and I'm really looking forward to hearing what you've got to say.
I'm excited to be here as well and just share with some of my story and what I've learned with a different audience in a different part of the world. So it's exciting.
Thank you. So let me ask you, could you define what is medical gaslighting? Could we just start with the obvious?
Medical gaslighting, to be honest with you, this has been evolution for me. So, it started with blind spots, which is like things in our healthcare system we think to be true that just aren't true, and then it kind of evolved into medical gaslighting, which happens more often in women. And it's like you go in with a group of symptoms of, brain fog, fatigue. I'm anxious, I don't sleep well. And then typically in women, they get blown off. Oh, you're anxious, you're a young mom, there's nothing wrong with you. And later on, you find out it's your post-concussive syndrome from 10 years ago, or the mold in your building that's making your brain inflamed, or your Lyme disease, no one diagnosed, or, it's really interesting. 75% of all neurotransmitters are made in your gut. So a lot of women I'll see actually have gut issues that actually mess up their neurotransmitters. And I've actually had some bipolar patients have their bipolar go away after treating their gut stuff. So it's like the idea that you have these symptoms that are nondescript that don't fit into a nice bucket. And the response of the healthcare system is it's all in your head. You can't be helped. Move along. And then that's resulted in me becoming a medical feminist, realizing that women, heart attack is a great example. For years and years and years, it's like, oh, you got stomach, you have upset stomach, your stomach's off, maybe you have a little shortness of breath, and you literally miss heart attacks and heart disease in women because they present 100% differently. In our country, in the United States right now, we literally, as of November of last year, voila, hormones are back for women. Well,
Exactly.
what's been the result? Potentially 140,000 women died prematurely. Potentially between 40 and 60 million women in our country were undertreated due to lack of access. And so all of a sudden, the FDA said it's okay. And I'm surprised we're not hearing people honestly just mad about being, particularly women in this middle age group that have been 100% undertreated because of this. And so medical gaslighting is one part of this, the trio I call it, that happens all the time in our healthcare system. And starts with the blind spots in the healthcare system, ends up being gaslighting. And the result is you have to be a proactive participant in your care, especially for women.
Okay, so let me ask you, how did you get into this? How did this become a passion topic for you? Because it was one of the topics, I asked you to define a specific topic, and this was one of the ones. And when I saw this, I was like, oh, we need to have a discussion about this.
Well, it all starts with my daughter. My wife and I adopted our daughter when she was about a year and a half, 2 years old. She was actually a patient of my wife's. And her story is that her birth mother did crystal meth throughout the entire pregnancy. And my daughter was born functionally blind. She was never supposed to walk, talk, or crawl. And the healthcare system gave her a pretty poor prognosis. And when we brought her into our home, our goal was to give her the best life possible. My wife saw something in her. She was like, she's going to be okay. There's a person in there. And she still wasn't at that point in time communicating. And she was kind of, she'd say hi, and that was about it, So we started feeding her, doing our stuff. And when we went back to the GI doctor, the GI doctor was, hey, she's still failure to thrive. She's still less than the fifth percentile. So the next thing we do is cut a hole in her stomach, put a feeding tube in, and pour nasty seed oil laden high fructose corn syrup formula into her butt belly and see what happens, right? And we said, no, that's not what we're going to do. We're going to work hard to do the right thing for her. And we got reported Child Protective Services for medical neglect because we refused to do what the doctor said. And I got this big, like, whoa, the system doesn't like it when you push back. This is weird. Now, at that point in time, I was a captain, becoming a major in the Air Force. My wife was a professional in the local environment. We navigated it and kind of did what we do, which is move forward. But 6 months later, and this was the big, big inflection point for me. 6 months later, my wife found a growth chart with kids with my daughter's official diagnosis, which is cerebral palsy. And she was 50th percentile. She was normal for her diagnosis. And all of a sudden, like the specialist has no idea. And they're getting ready to commit one surgery to her. And in the special needs world, one surgery leads to another, leads to another. And fast forward, my daughter's 20 right now. And as of now, she's had no surgical procedures in her entire life. The average kid with her diagnosis has had 13. And we've literally gotten to this point because we've done nothing the specialists recommend. Now, we go to all the specialists. Every time they make a new recommendation, I figure out another way around it. But that just kind of changed my entire practice of medicine. You start realizing there's whole groups of people out here with chronic fatigue, fibromyalgia, mood disorders, POTS, dysautonomia, chronic Lyme disease, autoimmune mystery things that are being overlooked by our system, put in these little boxes and mistreated and undertreated. And so I started seeing those patients in my clinic, and then eventually my entire practice evolved into this whole field of integrative functional medicine, which we've become kind of the place where all the people who've seen multiple doctors and multiple specialists have been told there's nothing wrong with them. It's all in their head. They can't be helped. They come see us and we figure out what's going on.
Okay, that's absolutely amazing. And, being a doctor yourself, I mean, that must have been particularly difficult to hear. I mean, the fact that a doctor would do that to another doctor, to me, is just crazy.
We get these blinders, especially in specialty fields. I mean, medicine in general, anything technical, anything scientific, anything, super educated, PhD, MD, people tend to be like, well, I've never heard of that, so it can't exist. Right. And it's like, I'm 3 board certifications into this now, multiple other certifications, clinical research company. I've been a principal investigator for over 70 medical trials, been published in Lancet. And at doing this for almost 25 years. And I'm kind of like, you know what? There's so much out there that you have no idea. I'm learning new things all the time. And so it's just one of those things, you have to have a certain degree of humility. It's almost like the people who aren't humble just don't know enough to be humble. Even if you're an expert in something, if you're not humble, you just haven't been beat down long enough. You haven't been proven wrong long enough. You haven't seen things you didn't expect enough times to realize, wow, the body's infinitely complex. This world we live in here is amazingly created, made, and I'm just honored to be a part of this. And every week, month, year, I learn new things, and it's really cool to see how these things actually change people's lives.
I love that. You would probably be not surprised, but happy to hear this. My father is an 80-year-old physician who is my role model and who has always been humble enough to realize he doesn't know everything, who has always, I mean, since my earliest memories of my father was on some type of exercise machine before it was fashionable to exercise, reading medical journals. Like, he was always constantly learning. And he completely veered, after COVID, he completely veered a lot of what he believed and what he's doing now. And so I believe the best practitioners of anything are the people who know as much as they know. There's always more to know, and you never stop learning. So I love that. So let me ask you, is there a difference between medical gaslighting and, let's say, misdiagnosis? Or how would you?
Well, misdiagnosis is just, it's kind of like, watching House or whatever the equivalent, show is,
I love that show.
where it's like, someone comes in with these symptoms. Oh, you've got malaria. No, you've got pneumonia. No, you've got concussion. And you make a presumptive diagnosis based on what's around you. And I'm sorry, it's the wrong diagnosis. And you keep on working until you get the right. And unfortunately, sometimes that's just the way medicine works when people are more complicated. Gaslighting is different. Gaslighting is you come in and I'm like, you don't have, it's all in your head. You're anxious. And they blow off your symptoms because it's not in their pattern recognition. It's not in their knowledge base in their mind that you might have chronic Lyme disease, or that you might have post-concussive syndrome that can actually give you gut issues and autoimmune problems, or that the building you're living in has water damage and has mold and a bunch of biotoxins in it, and actually might there's this thing called sick building syndrome in the 1980s. People forget about this. In the 1980s, there's a thing called sick building syndrome. People were getting sick from the buildings, and it was basically they're so tight that people were inhaling large amounts of VOCs, and it was giving them like the same syndrome. It's actually called chronic inflammatory response syndrome. The same syndrome that people get from moldy buildings. And so when you see these things that are atypical, and you say that's nothing, it's all in your head, you're anxious. It's just your postpartum depression, or you just have 4 kids. It's just you're a busy mom, or you're doing too much. You can't handle it, can you? Right? And you're like, like I've been handling it every day of my life until 2 years ago when I moved to this new city. And they get, particularly women more than men, get just kind of dismissed because what they're suffering or dealing with doesn't fit into these nice, neat little categories.
I was just about to ask you, are there different groups of people that would be more likely, somebody who's maybe very overweight, it's all blamed on their weight, or
Well, it's I guess you have to be more specific with that. It's women more than men. Um, Probably women in their childbearing years, because it's like you're told you can do it all, right? You have a career, so you get your master's degree, and you have a family, so you get married, and so you're raising a family. It's like, whoa, like who can do this, right? And you've got your superpower, which is estrogen, and then all of a sudden you have your third pregnancy, or you have an early, you have a miscarriage, or you do, okay, here you go, or you do fertility stuff because you start your family a little later, and that just messes everything up. People assume, well, it's just because you're taking too much on. It's like, no, we abuse our physiology, and the female's physiology is super unique. I mean, literally, you have a tumor inside your body. It's called a baby that's genetically different than you, and yet your body does not reject. You do not do an organ rejection of this person inside you, right? That's a pretty amazing physiological step. It's really super complicated if that to work the right way, which also makes women more susceptible to environmental toxins, environmental chemicals. And then we have a lot of things about, the average female puts 200 chemicals on her body every day before she leaves her house. And many of these are neuroendocrine disruptors, which is a fancy way of saying chemicals that act like hormones and mess your hormones up. And in that world, we just tend to blow it off because, that's you're just taking on too much. It's like, that's kind of where the gaslighting sits. It goes from everything from the chest pain stuff to hormones to infertility to, long COVID. My first long COVID patients were all females before long
well,
COVID was a thing. My first patient was a female researcher working at the local hospital, May of 2000. So if you remember, like the dating, that was before it was even recognized. That was when long COVID and vaccine-related things were considered. Well, actually, the vaccine wasn't out, but SARS. But like, it was verboten to even talk about that kind of stuff. And it was, and those patients were blown off, like, oh, you're stressed, And now we know it was long COVID for some people.
right, right. It's actually shocking now to think that no one realized, because they were talking about how bad COVID was and how dangerous it was and how it could kill you, that somebody who had it might not have some after effects or some problem from it, or it couldn't have brought something else on.
Well, people
So,
in my world, when it came along, we're like, okay, we've never seen this before. I understand that. But we've seen a lot of things just like this, whether it was the Russian flu in the late 1800s, which 8 or 10 years later, we started seeing a lot of Parkinson's, whether it was Spanish flu in the 1919 time frame. And again, same thing, 5 or 10 years later, we saw a lot of neurological issues. There was some weird viral thing that actually hit around the same time as well, that people started getting these demyelinating, almost like bipolar schizophrenic kind of things, or after the Hong Kong flu, or after the bird flu. I mean, like these idea of post-viral brain inflammation, post-viral immune dysregulation is actually a super, super common thing. So people in my world were saying, okay, yes, we don't exactly know about this SARS-CoV-2 thing, but we can use similar concepts to address it while we're waiting for the data. And to be honest with you, we got it 80% right. As far as how do we treat acute COVID, how do we treat long COVID, or post-acute sequela of COVID-19, which is the new technical name for it. And that's where our system had a massive blind spot where you have no idea what to do for this. There's nothing you can do for this. I'm like, I mean, yes and no. Yes, we don't have the exact data, but no, we know how to treat post-viral syndromes. We know how to treat acute viral syndromes. We can use IV vitamin C. We can use antivirals like ivermectin. We can use zinc. We can use quercetin. We can use all these other things. So it's just really interesting to see how that's a big example of a blind spot where our healthcare system was like blind for 2 years, while people like me were just still taking care of people with, none of my patients, this is an interesting data point, none of my patients died from COVID.
My dad too.
I personally credit it to, I've been checking vitamin D levels on my patients since 2003.
That's
Some of
right.
my patients I actually watched over the decade before they got COVID, the vitamin D levels go from 7, 8, 10, 12, 14 up to 60. And now we know the single biggest nutritional factor that determined whether you survived when you got COVID or not was actually your vitamin D status, which is also the reason why in Ireland, their national healthcare system was actually mailing during the pandemic individuals in their socialized healthcare system who had COPD and cystic fibrosis. They were mailing them vitamin D in the mail. So why was it okay for Ireland to do that? In the United States, it was, verboten. That was a massive one great example of a massive blind spot.
I mean, we could call it a blind spot, or we could call it some type of conspiracy.
But
Or,
let's be,
we don't have to go down that road.
I like to be generous and just
Okay.
I like to be generous. But you can go a lot of directions with that one. That's for sure.
It's 100%. That is 100% true. Do you think people of varying socioeconomic statuses might be more likely to be shoot off or gaslit?
It's an interesting question because yes and no. And so it's really interesting during the pandemic, our patients that were the most resistant to get the vaccine and were the most wanting to do alternative therapies were my African American patients. And it was really interesting. Like, I'm like, well, wait a second, you're like, why? And as you understood the Tuskegee experiments and a lot of things we've done in our country, like, wow, it made sense to me. Like, why you all don't want, I remember one of my patients, he was in the 70s and he was like, I don't want someone swabbing me. They're probably giving me COVID. And I remember thinking, that's the craziest thing I ever heard. But then I was like, well, I mean, we've done stuff like that before to this population of people. So he had justifications. So I think, do you have factors like that? And then, but that was really weird. My patients that popped in line the most were my educated patients. Women more than men, who were tracking everything on social media and watching the news. They were the ones who were like scared their kids were going to die. We also did clinical research on the vaccine with Pfizer during the pandemic, and they're the ones that wanted to get the experimental vaccine as soon as possible before anybody else. And so there are socioeconomic things at play, but sometimes it goes the opposite way you think it would go. So
Right, right. Do you think it's like, you know, America has rallied for a long time for socialized medicine. Like here in Israel, we have socialized medicine. England, Ireland, a lot of places have socialized medicine. And on the one hand, my friend had a benign brain tumor and didn't have to pay a penny out of pocket, which was amazing. But on the other hand, if you want an MRI or you need a test, you could wait. I don't know, you could give up your firstborn and then you'll get it 7 months later at 3 a.m. Do you know what I'm saying? So, meaning, do you think that I know even in America at this point that a doctor has like 7 minutes with a patient? Do you think that short time window of not having enough time contributes to some of that?
well, 100%. Like you've got 7 to 10 minutes. Like so, you come in and I have to like screen you for depression. After review your meds. After screen, have you had your colonoscopy done? My nurse has to. These are all mandates from the government, and that leaves even the little bit of time we have. So what can I do for you now? And you're like, well, I've got, these three things. I'm like, well, you've only got time for one, maybe two. So if you start going down this rabbit hole of I've got aches and pains and brain fog and I can't sleep and I got diarrhea and constipation, and I get really anxious sometimes, I'll be like, oh my gosh, this person's crazy. Like, how do I get out of here as fast as possible, right? And if you had half an hour, let me sit down and ask you some questions. When did this start? Oh, it started at your new job. Okay, it's probably your stress. Wait a second, your new job is in that old building downtown. I knew that building. I used to swim down there. This actually happened to a patient of mine when I was in college, and it's crazy moldy. Oh, and you have time to sit and ponder and think, and then maybe do some research on the patient afterwards. If you only got 7 minutes, you don't have time for any of that. It's super quick, super superficial. And if I can't answer the question in the 7 to 10 minutes, let me refer you to a specialist who might be able to. And part of the, it's really funny in our attempts to make things more affordable, we actually end up seeing more specialists because the primary care people don't have time to actually sit and think. And our system doesn't pay for cognitive work, which is sitting and thinking. It pays for procedures. And lo and behold, 3/4 of all physicians in America are specialists. and our healthcare system is ridiculously expensive because we do all these procedures to people. So when I was doing some of my trauma surgery training back, this was 2003. I learned about this thing called vomit syndrome, which is victims of modern imaging techniques. And part of vomit syndrome is you lose your clinical expertise and you depend on technology and imaging stuff to make diagnoses for you. Because that's all. If I got 7 minutes, let me order some tests and I'll see you back in a month. Well, what do you do? That's procedures and labs, and you're not actually using your cognitively trained clinical mind. And for me, I've had over 100,000 patient encounters in my career. So you don't use that expertise. You're limited to like these little small data points. And yes, 100% having short visit times makes that kind of poorer quality medicine be the primary type of medicine practiced in our country.
I'll just tell you as a little side note, I call myself a functional physical therapist because I'm also looking for the root cause of somebody's typically pain or musculoskeletal problem. And people always are like, do you want to see my imaging? And I'm like, no, like, I want to see how you move. I want to hear your story. I want to hear your history because people get so stuck on that MRI, oh my God, it's a herniated disc. Like, no, your life is not going to be over. It's okay. And very often the symptoms don't even match, that diagnosis. So I totally hear what you're saying. I totally hear that. So what should people do? Let's be practical. If you know you're somebody who is having so much of what you're describing, and that describes so many people who I think at this point, a lot of I'm 56. So a lot of women my age are being blown off with it's menopause, it's perimenopause, it's, take some hormones. And there are people who that doesn't work for.
Yeah. So, what was your question?
So my question was, what should people do? Like, does it need to be private treatment? Are there other, should they expect to spend money? Like, how should they advocate for themselves?
I think, in America, I know you're doing this in
No, you could, tons of people listen in America. I have people listening all over the world.
Okay, fair enough. So what I would say is you have to become educated, right? No matter where you're at in the world, you have to learn about like how your body works, find a reliable source of information, become the CEO of your own health, which means you have to know you better than anybody else. Trust your gut. It's really interesting. There's so much new neuroscience and data on these gut hunches. There's actually a whole field of medicine now and science about actually how your brain, your gut has as many neurons in it as your spinal cord does. And a lot of times you get this intuitive hunch or instinct before it comes into your subconscious. And so we're getting all this really cool data on trusting yourself. But in order to trust yourself, you have to become educated. You don't trust like blatant like craziness, but an educated self. So I think the first thing is just finding reliable sources that are vetted, that you trust, and trusting those. And then getting a team together of people that will listen to you. Like someone, if you come in with an article, hey, I was researching this and found out this, patients bring this stuff to me all the time. And I learn a lot actually of stuff from my patients. Is someone willing to hear your perspective? Because no one's going to know more about you than you. And that's the thing. If you talk to an expert or a physician and they're like, no, I know you better than you do. You're like, okay, I need to find someone else because obviously you don't know what clinical medicine really truly is. And so that's why I think, finding someone you can work with and getting educated and trusting yourself. And then that's of course of a learning process, but I feel like that's where we have to start, not blaming the system because it is what it is, being ready to invest in yourself, time as well as money, if you're not willing to invest time and money and change things, change your diet, change your environment, change your sleep patterns, maybe even change the people you hang out with, change what social media you watch, maybe stop watching social media. If you're not willing to make significant life changes, then, you're going to be stuck in our, standard of care system.
Okay, well, I mean, could you maybe share an example of somebody who's come to you, maybe that had been medically gaslit, and you found, I mean, I know you did share one or two things, including your own daughter, but.
Like I think of a patient that I've talked about before who was a little bit of lower socioeconomic status. She was, if I remember correctly, I believe she was on Medicaid and came to see me because she had like aches and pains and chronic fatigue and fibro. And, I think she had a diagnosis of potential bipolar as well. And she smoked, had a horrible diet. But the thing was, I was listening to her tell me about these things that multiple other doctors had heard. She didn't want to take a lot of medications and stuff. But she also had a lot of yeast overgrowth issues. Every time she got an antibiotic, she would get, vaginal candidiasis or vaginal yeast infection. had like a white coating on her tongue. I'm like, hmm, there's this thing called the yeast overgrowth syndrome, where your brain can get inflamed by yeast overgrowth. Yeast in your GI tract actually will release these things called pseudo neurotransmitters that tell your brain to actually change your behaviors. Are you willing to do an experiment? Let me give you diflucane for a week, and we'll see what happens. Right? 4 weeks later, she sends me, gives me a phone call. Hey, Dr. Hartman, can you refill that diflucan for me? All of my fibro symptoms and pain went away. And I'm like, oh, that's pretty cool. How about let's change your diet? And so it's really funny. She only wanted to refill the medication. She didn't want to change her diet. She didn't want to quit smoking or stop drinking diet soda, which is horrible for her. She just wanted to refill. So I said, I'll refill it one more time, but we need to make some changes and come back and see me. And she basically, didn't make any changes. And so I learned two things. One, that's an example of how the system kind of ignored her symptoms, but also she wasn't ready to make hard changes. She just wanted the quick fix. And so, yeah, and so that's where you have to like not just have someone who's going to listen to you, and that was someone who was gaslit. You also have to be willing to make changes when you find there's changes to be made.
Yeah, it's one of the hardest things. I mean, there are people that I've spoken to for years, people who have diagnoses that I knew about years ago, even before I was doing this podcast, like years ago. I mean, 10, 12 years ago, I knew already that, if you have MS or Parkinson's, that it was also gut related and you needed to change what you were eating. And and I get it. Like, I totally get it. It's not easy. Like, it's really, really not easy. And, but people often, and the same thing, like anybody who's coming to me for physical therapy is not going to lay on the table and have their back cracked or have me massage them for an hour. Because guess what? If you don't change the system, it's coming back in half an hour. So you have to be willing to make changes. It makes it so hard.
Well, dear, that actually reminds me. I actually want another patient who's a male who came to me with a diagnosis of multiple sclerosis from the University of Virginia here in Virginia. And they wanted to start him on a biologic, and he was like, "I'm not doing that." So he came to see me because I'm the out of the box kind of guy. And I'm thinking, you're a guy in your 30s with MS. Like, that's kind of a weird diagnosis. He had Lyme disease actually, and after doing IV Rocephin for a month, 80% of all of his MS symptoms went away. And he'd been in one of the top medical institutions on the East Coast in our country, been diagnosed with MS, and he had it on the MRI. But as you know, in autoimmune diseases, you have to have four things, and one of those is a chronic infection. And no one had actually looked to rule out any potential infections. And when that was happened, that his treatment was actually, and this is an example of a guy being, a blind spot, medically gaslit. And it's interesting. It took about 2
And
3 years.
misdiagnosed, it sounds like,
Well,
it sounds like misdiagnosed. Like,
that happens a lot too. So particularly with
yeah,
Lyme and mold related stuff.
yeah. I mean, I totally lost my train of thought in what I was going to say. But no, I know that does happen all the time. Oh, I know what I was going to say. That I actually didn't know you needed that for an autoimmune disease, that you needed to have a chronic infection. I didn't know that. But I do know that for so many things, like let's say Bell's palsy or even MS or all these things, I remember in PT school learning that it often comes after you have a virus.
Yeah.
So
Well,
nobody should be surprised if they had COVID and then all of these other things come out, because we always said all of these things come after a virus, or many of these things are side effects of any vaccine.
one thing's with viral infections, whether it's flu or pneumonia or COVID, is you can actually have a post-infectious reactivation of Epstein-Barr or herpes or even Lyme. And so one of the things we've seen in the clinical literature since with COVID is people getting underlying Lyme disease or Epstein-Barr reactivated. Then they get this autoimmune thing after COVID. And it's like, okay, this suppressed your immune system. This thing that had been there for years got reactivated. Now you got this thing. So it's actually a 2 or 3 order distance. But that's where I love this kind of medicine, because it always keeps you thinking, and sometimes you got to think a little deeper to find out what's going on with people.
So if somebody goes to the doctor, they're not feeling good, the doctor's just looking at their blood tests and they're like, no, you're fine. You're perimenopausal woman, or like you said, you're stressed, you have little kids. What should they do in that minute when they know? Should they just turn around and leave and look for someone like you, or look for you? Or is there something they should say to the doctor?
Oh, yeah, I would just, you can start with the person. Hopefully this is the person you have a relationship, and just say, look, just want to make sure you're listening to me. Like, this is new. I didn't have these problems before. It started this. You have to go in almost prepared. It started this date after these things. Are you sure this is all it could be? That's a great way to respond because the answer has to be no. I'm not sure this is all it could be. If their response is, I'm sure that's all it is, then like people ask me questions. Are you sure this is all it is, or could it be anything else? The answer always has to be, of course, it could be something else. Let's figure that out together. So I think just being prepared to ask a interrogative. Could it be anything else? If so, what else could it be? And if they're not willing to engage you at that small level, then you probably do need to find someone else.
Okay. And how can we, is there something you would say to physicians? Let's say there are physicians that are listening to this. Is there something you would say to physicians who, maybe you're opening their mind now to a new way of looking at things? And should medical schools be teaching something different?
I mean, this absolutely. It's like when I went to medical school, I had my cardiology block and my rheumatology block and my endocrinology block and my ER. You have these specialty blocks, but what's the block that's a specialty between the specialties, right? And that's what this is. This is like the gut-brain axis. There's a whole new field of medicine called psychoneuroimmunoendocrinology, which is how your mind and your immune system affects all this other stuff. And you can get a PhD in that field of study now, but yet you don't really learn about it that much in medical school or residency. So we definitely should be talking about it in medical school education. It could be a block, a 1-month block, a functional medicine block, or a 3-week thing. The Institute for Functional Medicine has some pretty good like intensives people can do, and they've been working with medical schools around the country. But this kind of medicine, it's cognitive, it's brain dependent. You have to think about the patient. You have to spend time with them. And our current healthcare system is geared towards procedures, and it just is. The economics are pushing away from a deeper dive into patients, and that's where where the system itself and the way it, you get what you pay for. And part of this goes against this deeper type of medicine, which in my practice, we have to charge a membership. People have to pay extra to see me because a 2-hour intake is not paid by that 15-minute insurance, reimbursement. So, but yeah, we definitely should be learning about this in medical school. But the thing about after this, there's definitely places people can get training. You can get a board certification in this kind of medicine, either through University of Arizona, or there's multiple places around the country you can actually do that. So I would just encourage people to find a course, find a conference, or just, I've done over 400 blogs on my website on mold, Lyme, hormones, illness, is a bunch of things. I've actually vetted over 500 books. So we've got a reading list on my website of some of the top physicians in our country that people can look at, and if they're curious. And even my podcast, where I take deep dives into, we're doing one on cardiovascular health and about basically how yours are old as your arteries. You have 60,000 miles of arteries, and we ignore the endothelium, which is literally the biggest endocrine organ in our body, lines our arteries. And so we're finished a six-part series on that on podcasts. So there's lots of places to get educated, but people just need to search for it, look, and be prepared to spend some time learning.
Okay, so do you think then that it's okay for people to go into their doctor and say, that GPT told me I might, just kidding. No, just kidding. But, I think I need to be tested for this or this or this. Like, do you think it's okay for people to ask the doctors to test them for certain things?
Well, I think you go in there educated. I've got, present yourself well. I'm a 52-year-old male I'm just making stuff up now, who's had some brain fog and fatigue for like 3 or 4 years. It started after, traumatic event with my son. I live on a farm. I've had some tick bites. I've had some gut issues for years. I had chronic constipation since I was a kid. Like, be prepared to tell your story in a fashion that and you can use AI for this, actually. You could actually use this to like prompt you, or even like use AI to like give you a one-pager that you can send to your provider before you go in and say, this is my presentation. And then have them like, okay, cool. They'll ask some questions to clarify things. If they take that and they ignore it, like, I don't want to see this. I mean, you're saving them like 20 minutes of interview time by giving it to them. And then maybe at the end, okay, great. So what could it be? Oh, I think you're depressed. I mean, could it be an autoimmune thing for Hashimoto's? Because I hear that people with positive thyroid antibodies can have all these symptoms. Or could it be related to my vitamin D or B12 or folic acid status or my fatty acid? Could you check? I think then you can ask some questions like, because I've heard if my CRP is elevated, that goes along with depression, particularly in people with schizophrenia and bipolar, because there's underlying infections with that. Could we check some of these labs? you know. But I would give them the opportunity to shine first. But you gotta make it easy for them. They got 15 minutes maybe. They can answer maybe 3 different questions you might have. So presenting that on the plate for them. Actually, I have on our website, we have a whole series on how to talk to your doctor that walks people through this very thing of how to prepare something to take it to them on a silver platter. And a good clinician who, though they're time limited, still cares about people will be like, oh, this is cool. You saved me so much time. What about this, this, and this? Cool. Let me do a physical. Let's do some testing. And then you can be, gently ask some questions. Patients ask me all the time to check stuff on them. And sometimes it's like, yes, 100%, that's a brilliant idea. And sometimes it's like, well, we've already checked that like 3 times last year. Like we don't need it for the 4th time.
Right.
I think with
And
medicine, we just have to realize that, particularly with AI, patients are more educated. They know more things. Misunderstanding, but we have to be willing in today's day and age to be open to that. And like, I did a malpractice conference for my malpractice insurance carrier like 6 weeks ago. And one of the big things physicians are getting reported to state boards of medicine for now is not listening to patients when they bring in their AI-driven questions. So, which is, I know, yeah, yeah. They were actually telling us about that basically because they want us to listen to our patients so we don't get reported to our state boards of medicine and get sued, which they have to pay for. So it's a new world out there. Um, we need to adapt to it.
so I just want to ask you, it sounded like you actually take insurance, but you have people just pay a little bit of an extra fee to be part of your practice. So
Yeah, so
is that correct?
it's a membership, so it's a hybrid. So you pay for your insurance, that will pay for labs and pay for imaging testing, and you want to use that, right? But I still only have like 12 minutes with you. I need 2 hours for an intake, plus an hour of time for reviewing your labs, plus another time after I follow up to figure out things. So the membership actually pays for extra time with me. Over and above that, it also pays for my other board specialties that aren't acknowledged by our current insurance system. So correct, I bill insurance, what insurance pays for, but then what it doesn't pay for, which is the majority of what I do, is a membership model around that.
And are you able, this is just a side note because I'm going to ask you in the end how people can get in touch with you and all of that, but are you able to treat people over Zoom or over, you know, a video platform?
Well, I am a board certified physician in the state of Virginia. I have a license for Arizona and Florida as well. Outside those states, I need to see someone physically for the first visit. After those, we can obviously do Zoom because that's been allowed since the pandemic. But the first visit really needs to be in person.
I agree. What do you think of online, like only over Zoom treatment?
Well, that's great for follow-up. Like if I've already seen someone, spent 2 hours with them, done a complete physical on them, I've
Right.
already got a plan. But it's, for example, someone comes in, they're angry. This actually happened to me with a young lady, 15 years old, had horrible anxiety, her heart rate raced. Sometimes she just get panic attacks would happen to her. She was told she had panic disorder and anxiety and was given SSRIs that made it worse. So she's given Prozac or something like that. Came to see me. I'm looking at her, and her eyeballs were big. I don't know if you've seen someone that's like the big, like the eyes were dilated. And she had like a little small trimmer, like really faint trimmer in her hand. So I'm like, let's get you up on the table. She lays down. I take her blood pressure and pulse. She sits up. I do it again. She gets against the wall. And literally her blood pressure went from like 120/70 to when she went on the wall, her systolic, the top number, went to less than 90 because I couldn't no longer pick it up on her arm. Her pulse went up to 140 beats a minute. She had POTS, which is a
Oh
type
my
of,
God.
which is an imbalance in your nervous system. Like you can't make that diagnosis over Zoom, right? And so there's some things you just have to see a person in person to get a feel for. And that was a great example where I would have never made that diagnosis on a Zoom call.
Okay. Wow. Okay. So primarily you are seeing people in person. So, okay. It makes that, listen, it makes a lot of sense. I can't do what I do over Zoom either. It's same thing. I have to see people once or twice. Once they've seen me once or twice, if I need to, I
I
can
mean,
do it. So,
and the reality is we have like so many people. We get like 40 to 50 calls a week from people to come to our clinics. Just from an economic status point, I don't have to do virtual. A lot of people do virtual because it's easier or because they need it to reach a bigger audience. I'm busy enough, so I don't need to do it. So I do it as a convenience to my patients. If you come see me, of course I'll be a convenience. You don't want to fly back from California or fly back up from Florida for a follow-up. 100% cool. But a lot of places do that because it's the only way they can kind of keep their practices going. We don't have that problem. So we I'd rather see less people and do a better job with less people than see more people and do less well with them.
That makes sense. Is there something across the board that you're seeing with people that
Well,
maybe is being missed in typical
well,
offices?
actually, yeah, this is something that actually might be on your radar, which is hypermobility. I see a lot of patients who have chronic fatigue, fibro, POTS, dysautonomia, joint aches and pains, nervous system issues, autoimmune problems. It actually comes down to the root cause is fascia. They have loose connective tissues, which automatically, 80% of all your nervous system is sensory in your fascia. So just imagine if you're a little loose, all of a sudden your nervous system is automatically a little heightened. Because of the hypermobility, they also get ptosis or sagging of their internal organs. So they tend to get more IBS, more gut, more digestive issues, which tend towards autoimmune problems. They have a higher need for certain nutrients like lots of vitamin C. All the vitamin D levels are low. They need more trace minerals, rare earth minerals. Those people's diets need to be more um, like what's the word I'm looking for? Like more like a paleo type diet where they're eating nutrient dense food, avoiding grains. And the hypermobility evaluation is basically, bait and score, right? Looking at your thumbs, your wrists, pulling people's skin. And that's something I see all the time.
That's
Depending
crazy.
depending what you read, maybe 20% of the population is hypermobile.
Are you finding that a lot of them have like EDS, like Ehlers-Danlos?
So
There's a lot of Ashkenazic Jewish girls.
well, it's on the spectrum. So EDS is this, and you dislocate joints and you have pain, right? So that the Bate score is the hypermobility. You don't have with additional things like your arms are long, you're tall. You have pisogenic papules, which are little microherniations on your heel, and with pain and dislocations, without like aneurysms and some crazy stuff. But a lot of people have hypermobile EDS, so they're like, to your point, like the ballet dancers. A lot of them are athletes actually, because when you're hypermobile, you can run faster, throw a ball quicker, your cerebellum's bigger, so you have quicker reaction times. But those people, if they overtrain, can also get sick easier, right? So they overtrain and they crash and get POTS and dysautonomia and chronic fatigue. And so I see a lot in um, um, certain athletic groups or certain professional groups. I did not know that about Ashkenazi Jews, but it makes sense because it's polygenic, which means there's multiple genes that contribute to it, which obviously would have a you know cultural background. But it's something that's I see all the time.
Ashkenazic are very inbred. So, like, yeah, right,
But yeah, I mean,
right.
I see it all the time. And it's I've yet to see a physician like who's the specialist for hypermobility. It's like, well, that's me because we've connected the dot with that with nutrition, gut, and autoimmune issues, and all these other mood imbalances. There's actually a thing called atlanto-occipital instability where you have a little bit of laxity and where your skull comes on your spine, and you get more compression of your brainstem, which can give you a lot of autonomic dysregulation symptoms, so hormone-related issues, blood pressure-related issues, nervous system-related issues, and they actually have an anatomical background to them, which is where craniosacral work can be helpful. Different types of physical therapy can be really helpful, like in your world. And it's like, who does that? And you have to find like the therapist who does craniosacral and the one who does, fascia work, and then the one who does dry needling, which is awesome for a lot of these things. And it's like, it's been fun learning about it, but even something like that that's in the physical therapy world still requires like additional sub specializations to help these people.
I'll just tell you, having treated many, that the only way it ever works, and many of them have been to physical therapy their whole lives, if you don't teach them the difference between stability and strength, which is what I do, and most people don't understand the difference between stability and strength, they
Yeah.
have to be stable first. And if they're not stable
Yeah.
first, if they can't control fine movement around all of the joints the right way, and you try to give them weights and you try to just make them strong, you just fall apart. Like you have to have stability first. So that's just a little veering sidetrack, but I could imagine a whole show actually on hypermobility being fascinating. So we can put that on the back burner for right now.
Well, let me give you one little data point. I was actually listening to an orthopedic surgeon lecture about this, who's done surgery on a lot of EDS patients, and he's had them start to do a carnivore diet. He's actually seen them dislocate their joints less. He had a couple patients who stopped dislocating their joints. And when I heard that him lecturing, I'm like, oh my gosh, I know why. And all of a sudden, I connected all these dots in my brain because it's like you have protein deficiencies, micronutrient deficiencies. You need more collagen, and we know now a lot of women, young women need more protein than they've been getting in their diets. All of a sudden, it's like this diet. So I just started recently in the last month recommending that to a lot of my hypermobile patients. Haven't had any come back yet, but I'm really excited to see what happens because it was one of those things. And they have a lot of gut issues in SIBO. A carnivore diet for 6 or 8 weeks can actually potentially starve out those bacteria. So I'm kind of excited to see what happens.
No, that's actually fascinating. And also, though, like you, I am a physical therapist. I try to discuss a lot of these issues with people that come in with certain issues or certain diagnoses that you need to understand. Sometimes the systemic inflammation, and systemic inflammation means understanding what's going on with the gut. But some of what I teach, because the basis of stability is breathing. And I've done a whole podcast with another friend of mine on breathing and how that really, it cures so many things, but it also moves the lymphatic system, it moves the gut, and it is also extremely helpful. But, you have to change how you eat as well. So, what would be one thing that you would want every person who's going to see their doctor to know? Is there something that people should be prepared for, if they are feeling the type of way that may just get them told you're fine, or it's all in your head. I feel like is a big one. Like you have anxiety, because we live in a world where, my God, we've been being told for 7 weeks. We've been being gaslit over here by Iran. We've been told for 7 weeks that they're gonna attack, or we're gonna attack, or something's gonna happen, and it's not happening. So I
Yeah,
just ignore the news now.
that could be really stressful, actually. So I would tell people that there's hope. There are answers out there. Um, don't stop looking. And so when you go to your doctor's the new doctor, you want to find someone who believes that with you. My journey started with my daughter. When I first started seeing her, I had no idea what I was doing. I was just a regular doctor. And I got hit in the face with either I figured out or she's doomed to 13 surgical procedures over the next, 20 years, right? And that's changed her health trajectory. It's positively impacted thousands of people, but it was my not accepting um, what I was told, knowing that she had a higher purpose to her life. She was in our family for a reason, and there are answers out there. Your body is infinitely complex. This world is infinitely complex, and so their answers is just where are they, and just to look for them. So my biggest thing would just be don't give up hope. And I actually wrote a book. The part of my book, Uncurable, which is about my daughter's story. It's written for that purpose, for people to realize like there are answers out there. Um, just got to keep on looking. And on a side note, routinely I'll have patients come in I'm working with that are kind of befuddling to me, and I'll be reading and one day read some random article about something, go like, ooh, wait a second, I could use this with patient X. I could use this one with patient Y. And actually we'll send them messages at like 5 o'clock in the morning through our portal, like, hey, got some ideas. Remind me about this when I see you next time. So there's answers out there. You just have to just don't give up. Don't give up. Never stop fighting for yourself, and find and work with someone who will do the same for you.
I like that. Before I ask you my favorite final question, I just wanted to ask you, how is your daughter doing now? And, if you want to talk a little bit about the book and where it's available.
How's she doing now? Well, she's turning 20 in April and she's moving out of the house in 3 or 4 months. So she's gone from, she was a vegetable when we got her. She didn't talk. And now she kind of jokes now about it. She's like, hey, Dad, I was supposed to be a vegetable, never walk and talk, and she'll just laugh about it. It's kind of funny. Yes, she's still got issues. Yes, she's still a mess. She still's in a wheelchair, walks with foam crutches, but she is like, people love her. They are attracted to her. She has the most endearing laugh. She's got a great personality. She loves people. She's living an amazing life. And it's like, it just sometimes makes me cry to think about the other option for her would be humped over in a chair in a corner somewhere, slobbering on herself. And that is, unfortunately, that's a lot of kids' futures. And so the book kind of talks about that, talks about our journey, how we interact with the healthcare system. I think the biggest thing about the book is we have like thousands of dollars of like free things in it, from a food sourcing guide to healthy buildings guide to how to talk to your doctor guide. So I would just recommend, if this interests people, I'll buy the book, read through it. We have lots of resources that they can get through QR codes in the book. And we adopted all of our kids. All of our kids have a crazy story. So it's not just her, it's my daughter Abigail, my son Khalil as well. He's the boy who lived, actually. He has an interesting story. He should be dead. He's alive. So it's a literally, the joke is he actually even has a scar on his neck and head from when he was actually crushed in an elevator when he was
Oh
like
my
8 years
gosh.
old. And so he kind of jokes about it now, but it was pretty harrowing there for a bit.
Oh my gosh.
Yeah.
Wow. You guys are special people, like really
We're
special people.
we're a little crazy, but that's okay.
You know what? The best people in the world are the crazy people. So, like, that's great.
There's actually an Apple commercial like that, the crazy ones, right? The very one of the first Apple commercials.
Was it? It could be.
Yeah,
It could be.
the
I've
crazy
been
ones.
here too long, probably. I probably
Oh
missed
yeah.
it,
Oh,
but
this was like back in the 80s or 90s. It was like the crazy ones had
wait.
Einstein and a bunch of Madame Curie and people who think crazy things. And it
Right.
was an old Apple commercial actually. It just popped in my head. So
Okay. No, it's great. It's really great. You just sound both sound like such special people. So let me ask you with that, what does spirituality mean to you?
spirituality to me means believing in something higher than yourself, being part of something bigger than yourself, and moving towards that. So for me, it's my faith. That's the reason we even adopted our daughter, because part of our faith is widow, orphan, stranger care. True religion is to care for those who can't care for themselves, and so um, it's the reason we adopted my daughter. And it's changed my career, my life, and so what it means to me is just realizing that there's something bigger than myself out there, something greater than myself, and going towards that higher good with all my heart, mind, soul, and strength.
You sound like that's something you're doing every single day. You sound like a really special doctor, and everybody should be lucky to find a doctor like you.
Thanks.
So, how can people find you?
The best single way, we've put together just a website, Aaron Hartman MD, and that will take you to my practice, which is Richmond Aaron Functional Medicine. It'll take you to my face, Facebook, Instagram, my YouTube channel, as well as to my podcast. So, but I tell people to start there. It's the easiest thing. Aaron Hartman MD. It's got a little story about me and pictures and stuff, and it'll take you to all the other resources and the book as well. The book website's uncurablebook.com, which you can get on Amazon. It's available on Audible and wherever books can be bought.
Okay, perfect. I'll link everything in the show notes, and I really appreciate your time.
Great. Thanks
Thank
a
you
lot.
so, so much. Hey everyone, I am excited to be back here with Rabbi Shlomo Ben Zeev, also known as my brother, who has always brought us fantastic insights into the Torah, and I am looking forward to hearing what he has to say about medical gaslighting.
I'll try not to gaslight you.
Please, please.
Um,
I get enough of that at home.
yeah, I'm sure. I'm sure. Okay, it's actually a very interesting topic. When you discussed this with me, the first thing that came to mind is a Gemara in Masechet Yuma, right? Masechet Yuma basically deals with the topic of fasting on Yom Kippur. I mean, one of the things that you deal with when you're fasting is, people get hungry, and sometimes hungry is okay, you can handle it, and sometimes hungry could mean something worse. Something worse. The Mishnah in Masechet Yuma says the Gemara is found in Daf Pei Gimel, right, 83a, for anybody that wants to look it up. Um, so the Gemara basically says, based off the Mishnah says that if somebody on Yom Kippur isn't feeling well, and you go to the doctor, and the doctor tells you you should eat food or you may die. It doesn't have to be 100% sure. It's not 100% sure that this person is in a deathly situation, but it is Yom Kippur, and eating on Yom Kippur and drinking on Yom Kippur is is severely punishable in the Torah. The basic law of the Torah, and this is actually the source for this entire halacha, is in Masechet Yuma. They ask the question: how do you know that a situation, a life-threatening situation, how do you know that it pushes off practically all, not all, but practically all of the isurim in the Torah? And the answer, the Gemara gives several answers. But it's learned in Masechet Yuma. But it's accepted halacha that if a person is in a deathly situation, as long as the way to get healed from it does not involve idol worship, murder, or sexual promiscuity, then the Torah absolutely says you should do it. Right? You need to eat pig, eat pig. You need to drive somewhere on Shabbos, drive somewhere on Shabbos. You need to eat on Yom Kippur. Oh, so that's what the Gemara says. That if you have a doctor that tells you on Yom Kippur you need to eat or you're going to die, so you listen to him and you eat. Now, what happens if you get into an argument? You have a patient that goes to the doctor on Yom Kippur, and he says to the doctor, "If I don't eat, I'm going to die." And the doctor looks at him and he goes, "I've checked your pulse, I've checked, all your vitals. You're not going to die." Who do you listen to? You listen to the patient or you listen to the doctor? And the Gemara says in no uncertain terms, you listen to the patient. It's learned from a pasuk in Sefer Mishlei, right, chapter 14, verse 10, if I remember correctly, that says, Lev yodea marat nafsho. The heart of a person knows its own suffering.
Wow.
And therefore, if the patient says, I need to eat or I'm going to die, and the doctor says, no, you don't, we listen to the patient. If that wasn't enough, the Gemara says, what happens if you have a patient like this who goes in front of a panel of doctors? You have 100 of the most highly dedicated, educated, all the MFCA or whatever it is, all the long the acronyms and whatever that they put at the in the titles.
Initials after the name.
You have the top doctors in the world, right? Hands down, nobody doubts that these are the 100 top doctors in the world, and every single one of them tells the guy, you don't need to eat, and you won't die if you eat. But he says, I'm going to die if I don't eat. Says the Gemara, you listen to the patient. You don't listen to the doctors. Okay, even if there's 100 against him that say he shouldn't. Now, should be taken with one thing. What happens if the patient says, I'm not going to die if I don't eat? And the doctor says, yes, you are. So the Gemara says, you listen to the doctor. Because the basic fundamental rule is, if it's a question of life or death, even if it doesn't have to be for sure, right? Even if it's just a suffix of whether it's life or death, the halacha is as long as it's not, idol worship, sexual promiscuity, or murder, so you do it in order to save the person's life. So clearly the Gemara is telling you that the fundamental rule is that a patient knows what they're talking about. It could be they don't have the ability to come along and tell you, it's connected to my kidneys. It could be they don't know exactly what, but they can tell you their situation is bad, right? I can tell. I feel my body. My body is telling me that there's something wrong. It's not functioning like it's supposed to. So the Gemara says, the halacha says, it's brought down in the Shulchan Aruch, that you're supposed to listen to the patient. The patient knows what he's talking about, even if he doesn't, even if he can't quantify for the doctor exactly what he's talking about. So that's that was the first thing that came to mind. I mean, it's obviously a very fundamental issue.
Well, I want to just say that I always say in terms of physical therapy that if people just listen to the patient will tell you what's wrong with them. That's number one. And number two, I love what you just did was you just took medical gaslighting and made us understand why, according to the Torah, nobody should be gaslit. That if the patient is telling you something is wrong with them, that you believe the patient, even if the tests show that there's no problem, but the patient is telling you there's a problem, that you should be listening to the patient. So in theory, if everybody would listen to Torah, there should be no medical gaslighting, because if somebody is telling you there's something wrong with me, you should be listening to them. And if the tests aren't showing it, then you need a different test or a different doctor.
Right. So, I mean, that goes in with another statement that Chazal say is, it's doctors don't like hearing this. Tov shebarofim legehenom, right? The best doctors go to hell. Now, the reason for that is because there's many doctors that don't look at themselves as the messenger to provide healing on behalf of the Kadosh Baruch Hu. They think that the position needs to be filled, and I'm the one filling it. And therefore, the best doctors, Baruch Hashem, I don't personally know any doctors like this. Maybe you do, but the ones that I know have the humility to be able to say that I don't know everything, and it could be that I'm wrong, and I'm just telling you based on what I understand and what I see. That's what I'm telling you. But a doctor with humility understands that if the patient says something is wrong, in all likelihood there's something wrong, that you don't have the right test, or you don't have the right knowledge, or you have to be able to open up your your horizons to the possibility that it's you that's limited and not the patient. That's certainly quite a possibility. Now, obviously, the Gemara was talking about an extreme case. It's talking about a case of life and death. But usually, when the Torah is talking, because that's the extremes you need to get to. It's not like, "Ow, I'm in pain." "Ow, you're in pain" isn't a reason to eat on Yom Kippur. "Ow, I'm in pain" probably depends. On Shabbos, for example, it's forbidden to take medications under any. In other words, if a person wants to take medication on Shabbos, you don't just go pop a pill, right? Only certain people there's a special gezerah, an enactment from the rabbis that was enacted on Shabbos and on Yom Tov, that you shouldn't take medication, because once upon a time, the way that medication was prepared was you took out your mortar and pestle, and you
Right.
ground everything on Shabbos, which is a malacha, right? And that's it's a severely punishable thing on Shabbos. But so therefore, in order to prevent people from doing it, not everybody had freshly ground ingredients which they could just mix together and make their medications. So even somebody who had everything prepared couldn't necessarily use the medication that they had prepared on Shabbos unless you meet certain stipulations. So medication might be a reason to take medication on Shabbos. Might be a reason to even do certain malachas which are forbidden midrabanan on Shabbos. But unless the person feels that I'm in a life and death situation, that wouldn't necessarily be a reason to be mechalel Shabbos, to go and, I don't know, drive to the doctor, or at least not by yourself. If a person is feeling it has, again, the rule of thumb, and this is a very important halacha when it comes to Shabbos. After all, the Shulchan Aruch says, quoting the Gemara and the Yerushalmi, that if a person goes to ask a question on Shabbos, whether I feel I might die, should I go to the hospital? Then the rabbi is remiss in his position, right? One of the first things that a rabbi should say is, if you have any doubt, it's a suffix, right? Any doubt whether you are in a life-threatening situation, do whatever is necessary in order to get out of it, right? You go to drive, you do whatever, you don't wait, don't hesitate. I heard amazing stories about people with Mesiras Nefesh who weren't Mechalel Shabbos, and by some miracle they didn't die. And you're not supposed to do that. If you have any suffix whatsoever, you pick yourself up and you do
There you
what's
go.
necessary in order to make sure you get out of that potential situation. And it doesn't have to be, doesn't even have to be 50-50. Any potentially life-threatening situation, 25%, that's all it is a perfectly good, valid reason to be Mechal Shabbos. All right, so obviously you have to, sit down and use your head. You can't just say, I think I'll die. Let's go. Let's hop in
Right.
the car. No, you have to use your head. Anything that is a real question that pushes off Shabbos, it pushes off Yom Tov, it pushes off Yom Kippur. That's so a rabbi who doesn't teach that is remiss. Okay, that's the way the Shulchan Aruch says it, and therefore it's certainly a halacha that needs to be known. But if you're not talking about that, then if a person's in extreme pain, then it could be that they might want to say, I don't know if it's life-threatening, but I'm in severe pain. You can go to do things which are asur midrabanan. For example, you have a non-Jewish friend. He doesn't have any mitzvah of keeping Shabbos, so you can ask them to do things on your behalf in order to get out of pain. That's perfectly permissible to do on Shabbos. There's no issur of speaking to non-Jews about doing malacha or doing any forbidden
Right.
act on Shabbos or Yom Tov on your behalf if you're doing it because of pain. So obviously, this is a broad topic, and I can't cover
Right.
all the basics here.
Yeah.
In general, those are situations we do need to, and therefore, when you're talking about medicine, and you're not talking about pushing off Shabbos, you're talking about, when it comes to the issue of, yes, you take the feeling of the patient into account, because the patient, right, Lev Yodeh Marat Nafsho means, right, the heart of a person knows its sorrows. The Shlomo Melech teaches in Mishlei, in Ecclesiastic, I don't even know how to pronounce that,
I
Ecclesiastes,
know,
I don't
no, I
know.
think it's Ecclesiastes. I'm also really bad with
Yeah.
that. The English
So,
pronunciations of yeah, it's
So
Mishlei,
that's what
right?
he's teaching. He says a patient knows what he's talking about. He might not be able to quantify it, but he can tell you that I am sick and I need
Right.
something. I need some help. Obviously, this isn't going to be an extro in order to teach doctors how to, how to treat patients al pi halacha and whatnot. But as a general rule, that's what it's talking about.
Right. Well, I just want to say back to the part where you're talking about doctors need to have humility and understand they don't know everything. The reason you say you don't know any is because our father was, Baruch Hashem, the best doctor, is a doctor with a lot of humility who's constantly learning. He's 80 years old. He's still learning things. And he's always
Mhm.
willing to admit that he doesn't know everything. And he does his best for every single person. But if you go into the Coupa system, which you have had to deal with, I'm sure you have met some doctors who, you know,
Quite possibly.
because I
I didn't
know.
have a long conversation. I didn't have a long conversation with
Hmm,
them. That's for sure.
ask Julie. But anyways, we're getting off track here. So yeah,
Right,
wow.
right.
No, but this is perfectly. This is a perfect point to prove from halacha why halachically medical gaslighting, according to the Torah, should
Imagine.
actually not be happening because
Yes.
people should be listening to the patient.
Yes.
So I love it. Thank you so much, Shlomo. This was so excellent.
You're welcome. Simcha, anytime.
We love hearing from you. This podcast is for informational purposes only. Please seek guidance from a trusted healthcare professional. By listening to this podcast, you release Holy Health and all of its guests from all liability. I'd like to thank Yakir Abelo for editing this podcast.